dissection of the fetal pig. Male versus female, we've got both, so one group maybe do a male today, one do a female. So before you even cut, just get an idea of external genitalia so you know what you're dealing with here. Pig is a fairly precocious species. Both testes you can see have descended down into the scrotum already at this point. And only one opening, right? Opening into the rectum, no opening into the vaginal cavity. Now, penis is not really well developed at this point. There hadn't been enough testosterone yet. You can see the umbilicus, and you can see where they've tied it off. So these are injected pigs. You can see some blue latex there. They've accessed the jugular side of the system with blue latex, trying to get the veins to pop. And they'll access the arterial side via the umbilical artery, right? And so you'll see some red latex injected through here to help you visualize some of the larger blood vessels internally. Really not unlike the testes and the scrotum here, there's not a whole lot of development of penis and prepuce yet. So really all you're seeing is the opening into the prepuce and the umbilicus, right? And that would be paralleled on the female. So you'll have umbilicus tied off, but notice there's no prepuce, nothing that looks like developing penis, and rather than scrotum, you've got rectum, and in the case of an animal, we would call that the vulva, right? External genitalia in the human would be labia, right? Okay, so there's your external genitalia, and then in a minute, I'll show you the differences internally. Now, the first thing you have to deal with here is the pig's not balanced, right? It's difficult to work with, so the first thing you want to get is get it opened up where you're not fighting with balance, and the way to do that quickly, I think, is just disarticulate the limbs. Right, so if you remember from your anatomy, scapula doesn't have a true articulation with the rib cage, it's just muscle and connective tissue. And there's really, since we're not interested in the external anatomy here, there's nothing you're going to hurt by disarticulating the limb at this point. We're not interested in muscle and bone, right? So just come right along the chest wall. Again, you don't really have to be too particular here because the chest wall will keep you from getting too deep and destroying structures that you want to see. Do the same thing on the other side. So you're just basically disarticulating the shoulder here. You can put a little bit of pressure on that, back pressure, just to expand that out. And now already I'm starting to get some balance here, right? So I can lay that out. And I can do the same thing on the hind limbs. Now this one you got to be a little more careful with because you don't have the rib cage to protect. So the thing you want to do here is try to stay as close to that inner thigh as you can, right? That gracilis muscle and the vastus intermedius, all that kind of stuff. Keep you from getting into the abdomen and cutting into things that you don't want. So try to visualize that inner thigh and just work your way right down to the hip joint. All right, try to stay off of the midline. And I've done the same thing. I've taken it all the way right down to the hip, and I can just sort of dislocate that hip right there and let the leg flop to the side. Do the same thing on the other side. Again, trying to stay off of the midline here because you've got scrotum and other structures you're going to want to identify a little bit later on. And again, you can put just a little bit of back pressure on that just to disarticulate the hip joint. And now at this point, you've got your specimen where it will pretty much be balanced, right? You don't have to worry about fighting with it with pins and all various things. Now, to actually get to the structures you need, just do a midline. All right, just start right underneath the mandible and stay right on the midline. You need to stay fairly shallow here. You don't need to get real deep till you get all the way up to the umbilicus. And then I don't care whether you go right or left, but preserve the umbilicus and go around to the side like that with the skin, and then just continue right on down. If you've got a male, continue right on down to the start of the scrotum. If it's female, just continue it all the way down almost to the vulva, right? Because you're just going to split this in half and open them up essentially. Okay, so now once I've got started here, now you've got a couple of options of how you want to get down to the internal areas. You can either, if you're comfortable with removing the skin this way, where you're just sort of picking it up and slipping the knife blade underneath the skin, you can start the process like this. Right? And then as you begin to see the body wall versus the skin, you can fairly easily just begin to skin the animal without worrying about destroying structure. The other way to do this, which is actually a little safer, particularly when you're down in areas that don't have bone to protect the organs, is to do what's called blunt dissection. And this is where you take a scissor like this, and rather than chopping with the scissor, use the blunt end of the scissor to dissect the tissues. So in a case like this, I'd go underneath the skin and then open the scissor up. And you see as I begin to start that now, what I'm doing is breaking down the subcutaneous tissues here very rapidly, right, with each of these strokes. And the nice thing about this is, since you're using the blunt side of the scissor, you're not whacking something in two, right? If something in there that you want to identify is in the way, you push it out of the way with the scissor rather than cut through it. This is typical surgeon's approach, right? If you're having surgery done on you, they would do this blunt dissection technique a lot to avoid cutting things. And that can be handy if you're trying to preserve something underneath, particularly down in the abdomen. You can move pretty quickly. And then when you see that all you're dealing with is skin, then you can just cut it and begin to peel it back. Right? And now do that on both sides. Get the skin peeled back, and you can just continue this again all the way down the abdomen. Now for the chest wall, ossification here of the bones is pretty slow at this point. So you're still dealing with a lot of hyaline cartilage or not a lot of mineral matrix, so it's not difficult to cut through. And I found scissors will do a good job. You can do a good job just with the blade as well. And just stay right on the midline, and we'll just do basically an open heart procedure here. Just split the sternum, right? And try to stay as shallow as you can. If you get too deep, you're going to go down and cut into the lung, into the heart. So get just right up underneath that sternum, and you can see without much effort at all, I can just break right into the chest cavity, right? So there's midline sternal transection, and immediately you begin to see the heart peak up. One thing that you'll want to pay attention to here before you get into the detail of individual structures is note cavities, right? And not necessarily are all the body cavities on your lists in your manual, but I'll be asking you about what is this space that the heart is sitting in right here as I look, right? See, as you begin to open that up, notice the membranes that are intact there. Look at that pericardial space, right? Look at the pleural space. They're all things that you've been over in class before, but you may not have seen them intact all the way down, right? So think about pleural cavity right here, and then abdominal cavity and the divisions as you go down through. Right? Now, once you have made your sternal incision here and you're actually into the thoracic cavity, to really get a good idea of the entire thing, it's probably best to remove the lateral body wall or the lateral chest wall. So just follow the margin of the rib right down. Of course, now once I'm down into the cavity here, I can see that I'm not cutting anything, so I don't need to bluntly dissect. I'll just cut that abdominal wall. Do this kind of at arm's length, because you see these things will retain some fluid in here, and again, if you're pushing on these things, you can get fluid squirting different directions, so you may not want that. Just be careful as you're doing this. All right. All right, now, once I've got the lateral body wall pulled away, usually you can just go toward the bottom of the rib cage here, and I'm going to remove part of the diaphragm. Again, be aware as you're making these cuts, you'll see these little openings and holes, right? This is a great example. Now, you'll lose this architecture, of course, as you remove the body wall, but as I make this cut right here, I can clearly see diaphragm, which is dividing thoracic cavity from peritoneal cavity. I can see the liver poking up. I can see the heart. And now as I look at this, I can begin to see the cavities. There's that pericardial space with the pericardial membrane around the heart. Here's the pleural space. Right? I'm looking at these membranes. I can see pieces of the lung sticking out. Right? And notice that sharp margin of the lung right there. These pigs are taken before they're actually birthed, right? So they die literally in the uterus, so they've never taken a breath. And you can verify that by that very sharp edge, right? If this pig had breathed, that pulmonary tissue there would be spongy, right? You'd still have some of that elasticity to it. So if I stuck a pin right there, you can see that membrane clearly sticking out right there. If I stick a pin in that between the body wall and the lung and ask you what space is that, you tell me it's the pleural space, right? That's what we talked about, that being a theoretical space. If the lung was inflated, it would be right up against the body wall. But Now you see that as a real space. You could get blood down in there. You could get air down in there, water, etc. Right? It could become a physical space. So pause and take a look at the structure of the cavities as well as just the organs. Okay? And then once you've got that pulled away, then again you can just come down to the axillary area, and the ribs are very easy to cut right through. And you can just take this all the way up to the sternum. Right? And now you've got that better sort of side view. You can see the heart easily, lungs, pleural space, all that kind of stuff. Okay. Now, once you're fairly comfortable with the thoracic area, just continue your cut. And remember, do try to preserve the umbilicus as long as you can, primarily for that structure right there. You see what I've got underneath the scissors right here? This is going right into the liver. This is part of the fetal circulation. I've got the umbilicus in my left hand, and I've got this tube going from the umbilicus to the liver, ultimately to the vena cava. Now that's return circuit for blood from pig back to the maternal circulation. The artery is right here, so you want to think of this as the vein for the umbilical system back to the mother, and right here you have one of the arteries. Now the arteries are actually paired, and you can see the red latex in there, right? And we'll cut that away where you can see a better view of that. Now, once the pig is born, obviously you don't need that anymore, right? Pig's going to keep its blood, doesn't have to go back to mother. So that will atrophy and become falciform ligament. Right? So once you've seen that, technically what would be a ligament now, go ahead and transect that, and then you can cut away the rest of the lateral body wall and continue that on down until you make it all the way to the pelvis and really open this up so that you can see it, right? Now again, you're going to have some fluid around here. You may want to keep some paper towels handy where you can put some paper towels in here and kind of daub this, remove any of this excess fluid here if it's bothering your view. And then just start to work your way down through the abdominal cavity, just like you did with thoracic. Liver, right? Very obvious structure. Exceptionally developed at this point relative to many of the other organs here because the pig's actually using its liver, right? Pig's not eating, it's not using its digestive tract, but it is metabolizing, so the liver is well developed. The other organ you'll notice that looks a little over large relative to everything else is the kidney, down here against posterior body wall. Pig's using its kidney. It's got to manufacture urine, right? It's building toxins, so the kidney's actually functioning in this pig. Here you go with the membrane systems again, right? Here's the body wall. And notice as I take the scissor, I can literally peel that membrane up off the surface of the body wall. If I have a pin in that, what's the name of that?
Mesentery?
It's not mesentery. What covers the surface of the organs? Now, what were the membranes we just talked about up here? Chest cavity. Okay, so the membranes are plural. The one that's on the body wall, parietal or visceral? The name viscera means organ, right? So the membrane that covers the body wall is parietal. The membrane that covers the surface of the organ is visceral, right? And up here, it would be pleura. Down here, it's peritoneal, right? So if I have a membrane in that, or a pin in that shiny membrane, that is parietal peritoneum, right? And the shiny membrane that's on the surface of all these organs then would be visceral peritoneum. Right? That's the pairing between these two. Right? And then just continue with the organs. Make sure you can see gallbladder. See it embedded literally in the base of the liver. Usually we'll have that characteristic green staining because we're already getting a little bile production here, right? Liver's functioning, so we're getting some bile that's in the system and it's staining. You can actually see the bile duct right there, from gallbladder down into duodenum. Stomach, right? We're looking at greater curvature right here. If I pull on it a little bit, this will be the fundic area up here. And if those of you that really want to do a tedious dissection, you could go down in here and dissect down between the liver and the stomach and find the esophagus where it leaves and enters up here. But now that's very deep. You'd have to remove all of these tissues. If you want to do that, make sure you do it last, right? Because you'll destroy everything else if you do that. Pylorus, use your hands. If you feel this part of the stomach up here, it's very flaccid. When you come down here, you feel a hard knot. That's that pyloric sphincter. Right? So there's the stomach coning down into what has to be the duodenum. Pyloric sphincter right there. Along a greater curvature, you've got spleen with its splenic ligament that's holding it in place. And if I break down a little of that ligament, I'm going to do a little bit more here. Got to be really careful here. I'm trying to get to the pancreas, which is very fragile tissue. Notice right here is this cobblestone-looking, very thin layer of tissue that resides right at the level of the duodenum and posterior surface of the stomach, and that's pancreas, right? Glandular tissue embedded in that membrane. Remember, I warned you guys that this was very, very fragile area right in here, right? Very easy to tear that tissue. And the other landmarks that you have here are also the transverse colon. So you've got stomach, duodenum as the outflow tract, pancreas right here, and transverse colon. Okay, I'll try to break down a little bit more of this mesentery. And as you can see, the transverse colon coursing right across here, and then if I move the rest of the small intestine out of the way, and again break down a little bit more of this membrane, you'll see that colon make a 90-degree bend right there and head directly down this direction. That would be descending colon. Right? So there's your transverse colon right there, becomes descending colon. Notice that the pig doesn't have the sigmoid flexure, right? It's just headed straight down and becomes the rectum, straight tube, right, for defecation. Now, here's a departure from human anatomy. If you remember, our ileum dumps into the cecum, which becomes ascending colon over here, heads up on the right side, then becomes transverse colon, traverses the body, then heads down and becomes descending colon. The pig has a spiral colon in place of that. Okay, so this is some anatomy that you would not see in the human. You do get an appreciation, though, for the cecum. See this, how it blind ends right here? And if this was human anatomy, we would find an appendix right off of that blind end right there, right? So there's the start of large intestine. Right? Small intestine, all of this, or the vast majority of this, is all jejunum. Right? You get an idea of the mesentery there. See how it's connected by that shiny membrane? See how vascular that is? Blood vessels supplying all that. So this is all for nutrient absorption. Right? Literally meters and meters of this in an adult human, right, if it was all stretched out. Right? Again, notice all of this is connected by the root of the mesentery. Right? I can pull all of that together. It's all free-floating until it connects at the back of the body wall. That'd be where that mesentery goes in. Okay? Small intestine. We've already looked at descending colon. Looked at the kidney. Again, remember the kidney is retroperitoneal. If I use a blunt dissection again, get an idea of that membrane, and then if I break that membrane down, underneath that is the kidney itself, right? Retroperitoneal. Again, you can see that pocket underneath there. What's this tube right here? See it going right into the renal hilus, right? So there's your ureter, headed from the kidney, taking urine down for storage. And I'm going to cut this back so it'll stay on midline now so you get a little better perspective. Okay. I've literally cut through the bladder so you can see it, right? There's the surface, that transitional epithelium. All right, so this is all together right here. Umbilical arteries, as they come in, I've cut through one of them right there. Ureter would come right through here to the trigone of the bladder and empty urine into the bladder for storage. Right? And you can actually get an appreciation of that storage as I've cut right into it there. Okay. Now, we're dealing with male here. Right? So the last item then is reproduction. And again, urinary bladder in the center with the umbilical arteries on each side. Now notice there's no other tubular structures in here. You see testicular artery as it's going down, disappearing right there on either side. And then you see these two little tubes here. And then again on the opposite side. And notice that those two little tubes are diving in and going underneath the same place where the ureter is going. There's the vas deferens, right? And that would be the ejaculatory duct right underneath there as they empty into the urethra. And then so if I was to take that little vas and pull on that, literally I'm pulling on the spermatic cord and on the testes as it connects down through here, right? So that little piece of tissue right there is going down into the inguinal canal and then down into the scrotum. Right? So if you end up with a male, go ahead and maybe open that up. You can start from either direction. You could start from the inguinal canal and work your way back in, or sometimes it's better, I think, if you'll just make an incision in the scrotum so that you can get an idea of the testes in place. Okay, so there is the testicle then as I've removed it. And you can also see the head of the epididymis. I'll break down a little bit more of this connective tissue now. Notice what's happening as I pull on that, right? There's the connection of vas deferens will exit the abdominal cavity, go through the inguinal canal, and end up down connecting to the testes. Right? Female, for comparison. Again, external genitalia you've already seen, and I'm just going to open the abdominal wall here quickly so that you can see what I mean? Always work at arm's length. You just never know where fluid's going to come out of these little pigs, even the small ones. Fluid in here, I'm going to get rid of. All right, now, a little more fluid there. Now notice the difference here. Rather than a vas deferens, I now have this little structure, which is the ovary, and a tube connecting it. Right, and notice the tube dives down sort of underneath the bladder, just like you had in the male. So there's a urinary bladder in the middle, arteries on either side, umbilical arteries. And now rather than a vas deferens and a scrotum, I've got uterus, that's really the uterine tube that we're looking at right there, and then the ovary. Right, and that would be on the left side of the animal, and then over here would be its counterpart on the right. Okay, so you can see now the paired tubes. Now in the human being, which are not litter-bearing species, you wouldn't have a tubular construction like this, right? This is typical for the litter-bearing species so that you could have individual fetuses stacked up in each one of those long tubes. If we were dealing with a human, it would look like one body of a uterus, right? And then you'd see the two oviducts splay out and you'd see the two paired ovaries in there, right? About the only other thing, you can actually pick this up and pull on it, right? And just like everything else in the abdominal cavity, it's attached to the body wall via membrane system, right? And so if I had a pin in that, you would tell me broad ligament, right? That's what is suspending ovary, uterus, oviduct, everything from the body wall. Okay? Now that's most of the things really that you guys need to go over. Now you'll need to go back up and do a little bit more work on the neck. I'd like for you guys to see the thyroid gland, larynx, trachea, that kind of stuff, and to be able to see the neck structures. Again, it's kind of handy maybe to do that blunt dissection technique where you get the skin and just sort of peel it back and do that on both sides. This is maybe the most tedious area in terms of dissection because you've got several blood vessels, less room to work. Really like you all at least to be able to see clearly that jugular furrow, right, and how it orients, because again, there's a lot of landmarks in there. Now you're going to have superficial muscles here that you're going to have to cut away. And again, bluntly dissecting the muscles oftentimes will help as you get deeper with each layer. And then at some point, you're going to start getting down into structures you need to see. You can see salivary gland, parotid salivary gland peeking out underneath the tissues here. I've got larynx, and again, use your fingers. You can feel that cricoid and thyroid cartilages right there. They're very tough, right? And if you move down just a little bit, the tissue gets much softer right there. Again, it's just sort of bluntly dissecting. And I'll begin to see the tracheal rings as this cones down from larynx down into trachea, which is more superficial. Now, thymus is highly variable in your pigs. This particular one, here's some thymus right here down. See, that, again, you get that glandular sort of a cobblestone appearance. Thymus can occur about anywhere from the neck down to the chest cavity. Generally, it's more superficial. It will always have that cobblestone appearance to it. Right? So as soon as you make your neck incision and start moving things out of the way, look for that thymus early on. It'll be one of the first things you see. As you get deeper, you'll bump into much darker tissue. That is the thyroid gland. And again, blunt dissection oftentimes is very helpful once you get down in here to keep from destroying the blood vessels. And we'll stretch right along that jugular furrow. And let's see what preserved well here. Again, let the latex help you out a little bit. So I can see internal jugular vein, there's the blue, right? And I'm going to try, there we go, to separate. Remember, in the body, it's very common for nerve, artery, and vein all to run together, and that's exactly what you're seeing right there. Right, so you've got the blue being the venous side. These pigs did not inject very well with the red side. I can tell you that that's the artery because I know where it is, and also I can feel that tougher consistency of it, right? But unfortunately, it did not get the real obvious red in it that it sometimes does. And then nerves are white cords. See if I can pull that out a little bit better so you guys can see it. There you go. Right side by side, you've got an artery and a nerve, right? Nerves always have that white, think myelin, right? Fatty sort of a tissue. So there's your vagus nerve. And as far as trying to identify nerves through here, that's really probably the most realistic place that you're going to actually see is catch that vagus nerve in the jugular furrow. Right? I don't think I'd try to spend much more time than that. And one more structure I'm going to try to identify for you all. There we go. Okay, now notice with thymus, the only thing that might confuse you gland-wise up in here, salivary glands are going to be way up underneath the mandible, right? They're located relatively high. That shouldn't be a problem. Thymus could be anywhere in here. It'll be large and cobblestone in appearance. The other gland is the thyroid, and the thyroid is the deeper of the glands. Thyroid will always be generally just a little inferior to where the trachea sits, and typically right on the midline. It hasn't really gotten that bilobular side-by-side shape yet, right? And it'll be more glistening in a darker color like that. So see if you can identify that thyroid as you go through there as well. Okay, I think that should be enough to get you guys started, right? And as you go through and get in deeper and deeper dissections and start looking at the cavities and some of the larger blood vessels and removing some of these things, I'll just circulate around and help point things out.